Hello, guys. Welcome to our first episode of our lecture series. In today's episode, we are going to talk about gender identity disorders. We are going to introduce, define, know the condition's etiology, manifestations, treatment therapies, and ethical legal considerations. Without further ado, let's get into it. The origin of the word gender came from the Old French genre, now termed as genre. This means kind, sort, or genus. Generally, children are assigned to their gender at birth based on their anatomy and chromosomes. For most children, this gender assignment corresponds to their gender identity, an innate sense of identifying oneself as male or female. Some children might experience an incongruity and grow into transgender adults. Gender identity is defined as personal conception of oneself as a male or female, or rarely both or neither. This concept is intimately related to the concept of gender role, which is defined as the outward manifestations of personality that reflect the gender identity. Gender identity, in nearly all instances, is self-determined as a result of a combination of inherent and extrinsic or environmental factors. Gender role, on the other hand, is manifested within society or observable factors such as behavior and appearance. For example, if a person considers himself a male and is most comfortable referring to his personal gender in masculine terms, then his gender identity is male. However, his gender role is male only if he demonstrates typical male characteristics in behavior, dress, and mannerisms. As to the etiology and pathology of this condition, biological and psychosocial factors are deemed significant. Biological factors believed that resting state of man or in tissue of a man causes and results in this condition. It also believes that males are initially female and as a fetus develops, a male is produced only if an androgen is introduced by Y chromosomes. And third, it believes that maleness and masculinity depends on fetal and perinatal androgens. As to the psychosocial factors, it believes that the formation of gender identity is influenced by the interaction of children's temperament and parents' qualities and attitudes. And it also believes that sex role stereotypes are the beliefs, characteristics, and behaviors of an individual culture that are deemed normal and appropriate for boys and girls to possess. This condition can be manifested in the following. First, a person who has a penis and all other physical traits of a male might feel instead that they are actually a female. Or someone with the physical characteristic of a female would feel their true identity is male. Then third, the discomfort with your male or female body can be so intense that it can interfere with your normal life, for instance, at school or work, or even during social activities. Fourth, feeling that your body does not reflect your true gender can cause severe distress, anxiety, and depression. A client with this condition may explicitly or implicitly show defense mechanism. This can be in form of displacement, denial, repression, sublimation, projection, intellectualization, rationalization, repression, and reaction formation. Though these may show in many forms in different populations, the most common ones are displacement and denial. Displacement involves taking out of frustration, feelings, and impulses on people or objects that are less threatening. Denial, on the other hand, functions to protect the ego from things with which an individual cannot cope. Now, you may be asking yourself, how can someone treat or manage this condition? There are treatment therapies available, Treatment options might include changes in gender expression and role. These are achievable through hormone therapy, surgery, and behavioral therapy. First, hormone therapy. It seeks maximum feminization or masculinization. Others might feel relief from gender dysphoria by using hormones to minimize secondary sex characteristics such as breast and facial hair. Treatment are based on your goals, as well as an evaluation of the risk and benefits of medication use, the presence of any other conditions, and consideration of your social and economic issues. Second are surgical therapies, such as feminizing surgery or masculinizing surgery to change the breast or chest, external genitalia, internal genitalia, facial features, and body contouring. And third, behavioral therapy. Behavioral therapy will aid an individual explore gender concerns and find ways to lessen gender identity disorders. The goal is to help transgender and gender nonconforming individuals become comfortable with their gender identity expression, enabling success in relationships, education, and work. This therapy can also address any other mental health concerns. This treatment aims to improve your psychological well-being, quality of life, and self-fulfillment. Nursing management of a patient with gender identity disorders includes first, assessment of patient's sexual history and previous level of satisfaction in sexual relationships. Also assess patient's perception of the problem. Assess for any medication which might be affecting the libido. Second, assist the therapist as necessary in the plan of behavior modification to help decrease variant behavior, and also refer for additional counseling or sex therapy if required. There are many ethical legal considerations when it comes to this condition. A client may be exposed to prejudice and be alienated and feel that way. However, it can be addressed by the healthcare workers through upholding social justice. And that's it for gender identity disorders. Thank you guys, and see you in the next one.